Good morning and welcome to the Great Lakes Health and Wellness Program with Kaleida Health on the legendary Power 96.5. I'm your host, Francesca Messiah from Kaleida Health. And at Kaleida, we are concerned about the health of your family, your neighbors, and our community. And especially during the COVID-19 pandemic. At Kaleida Health, we continue to advance the health of our community. Did you know that Kaleida offers over 30 virtual and pre-recorded presentations, which upon request and for free, you can use for your classroom, for your students, for your religious group, not-for-profit business, PTA, PTO, teacher in service, anything you can think of for your group at the library. We have several requests that come in for requesting in-person as well as virtual presentations. And I want to say through COVID, we have been just as busy with our virtual presentations as we were before COVID with our in-person presentations. Also, I just want to mention that we do have other topics. We have topics on cancer and oncology. We have women's health, maternal health, diabetes, stroke, children's health, LGBTQ health, you name it. If you'd like for us to come and be part of your program, your classroom, please call 716-863-8717. Again, that's 716-863-8717, or email fmessiah, that's FMESIAH at Kaleida Health, that's KALEIDAHEALTH.org. And if you're wondering if we're able to interface through your program on Facebook Live or WebEx, radio interview, call-in shows, Skype, we can do all of that. Just call 863-8717 or email fmessiah, MESIAH at KaleidaHealth.org. Just ask and we'll work on how we can make it happen. At Kaleida Health, our laboratory department is, we're in the process of scheduling presentations, either virtual or live, meeting with high school students throughout Western New York about careers in science. So again, if you would like for us to speak with your school, your church group, your youth program about careers and careers in science, again, please call 716-863-8717 and leave a message, or email fmessiah, MESIAH at KaleidaHealth.org. I also want to say that I appreciate receiving invitations about upcoming outreach. As part of the outreach department, I am going out doing outreach in person, and just keep sending the requests. I look forward to that, to attending your event. Kaleida Health is the largest healthcare provider in Western New York, serving the area's 8 counties with state-of-the-art technology. Kaleida facilities include Buffalo General Medical Center, Gates Vascular Institute, Millard Fillmore Suburban Hospital, and the J.R. Oshai Hospital. Also, Great Lakes Cancer Care Collaborative, Visiting Nursing Association, 2 long-term care facilities, and clinics. At all of our sites, we are taking all the precautions from the New York State Department of Health and the Center for Disease Control, CDC, towards COVID. So we are following the COVID guidelines, and all of Kaleida Health facilities are accredited by the DNV. If you're interested in hearing any past interviews over the past 3 years, please visit www.kaleidahealth.org/GLH radio. Okay, well, we have a very exciting program today, a hot topic, as I would like to coin the phrase from another program. And our guest this morning is Dr. Berga. Good morning, Dr. Berger. How are you?
I am excellent. So nice to be with you. Thank you.
Oh, thank you. And I just have to tell our guests that Dr. Berger was with us a couple of months ago. Dr. Berger is a professor and chair of the Department of Obstetricians and Gynecology at the Jacobs School of Medicine and Biomedical Sciences, the University of Buffalo. She's also president of the UBMD why can't I get the word out? So help me out there, Dr. Berger.
Obstetrics.
Obstetrics, yes, and gynecology, and also the medical director of the OBGYN and Women's Health Program Development at the Oshai Children's Hospital at Kaleida Health. And our topic for today, and we've brought it up before, but it's a topic that still there are a lot of questions about, and that is COVID-19 and maternal health. And Dr. Berger is an expert in that area, and that's why we have her on this morning. So, Dr. Berger, if a woman is pregnant during this time, during this COVID-19 pandemic time, or trying to get pregnant, are there precautions that she should take?
Sure. There are lots of things that we advise in the middle of a pandemic, and lots of things that we advise before getting pregnant, including not smoking and not drinking and being in good health. But we have a special new one to add to that list, which is getting COVID-19 vaccination.
Let's talk about the COVID-19 vaccination, because I know there are so many ways that people and women and women/pregnant moms receive information. And what is the truth? What could you tell us? Why do you feel there's a hesitancy about women who are expecting not to take the vaccine, and what are the facts that we should let them know why they should take the vaccine, should get the vaccine?
There are lots of barriers, and some of them are information, and some of the barriers are fear. When you're pregnant, you want to do everything you can to have a healthy pregnancy, to have a healthy baby, and something that is perceived as an unknown might be perceived as a risk to baby, or perceived as a risk to mom. And the facts are actually different, but I think sometimes we lead with fear, and particularly when we're in a novel situation. So unfortunately, the pandemic isn't as novel as it once was. It's lingering far longer than we want. But as a result of that, we actually now have a lot more data and a lot more of the safety data than we had before.
Will taking the vaccine, will that make the pregnant mom sick?
No. And in fact, we didn't ever think it would. I mean, the mechanism of action, that's what it's called, the way the vaccine works, was predicted not to have any negative consequences. But when we started rolling it out, people had a day or two where they didn't feel, fantastic. Like, they could tell they got vaccinated. And I think that's true for the flu vaccine and a number of vaccinations that we have. So, I mean, people just worried. And it's hard not to worry when you're pregnant. And it's hard not to worry when you've got something new to deal with, both the pandemic and the vaccination, right? That's a lot of novelty. So I think people have been asking for information, and they want to know what's going on. So now we have some information, and so it's a good time to kind of go back and discuss, why do we get vaccinated during pregnancy against COVID-19?
Is there a difference between how a mom might act? Not act, but react to taking the Moderna vaccine versus the Pfizer vaccine when she's pregnant, or are they about the same?
They are about the same. So the good news is 139,000 or more pregnant women have been vaccinated during pregnancy, all stages. And the reactions are no more in a pregnant woman than in a non-pregnant woman, and no more than with one than the other. So everybody has the, the range is from no symptoms at all to having a few symptoms to having like a day where you don't feel so great. But all of those reactions pale in comparison to how you feel if you get COVID-19 when you're pregnant. And really just now we have new data, and it's dramatic. And so I think that's what's got us really galvanized to make sure people know these new data, because it just is dramatic what happens when you get COVID-19 when you're pregnant. So you have almost a 50% reduction in the chance of having a term baby, i.e. going 37 weeks and more. So, and another way of saying that is you're very likely, if you get COVID-19 during pregnancy, to have a preterm delivery. And not only is that not good for baby, obviously, sometimes that's because mom is so sick that she actually gives birth, because that is sort of somehow what Mother Nature does sometimes when we're very, very sick. To get us to heal, we get a miscarriage or we get a preterm delivery. So they looked at the vaccination to say, gosh, does it cause preterm delivery? Does it cause a miscarriage? And there were almost 1 million people that were studied, and about 850,000 of those women did not actually have COVID, and almost 20,000 women did. That's a huge number. I'm sorry to hear that large of a number, but the risks were very high of needing ICU admission. So a 6-fold increase in the risk of needing to go to the ICU if you got actually COVID infection, and a 14-fold increase in the risk of needing mechanical ventilation. So this is on top of that risk of preterm delivery. And actually there was a 10-fold increase in the risk of death. Actually, it's 15 if you calculate it out. So a more than 10-fold increase in the risk of death. That's just alarming. And so that's why we're talking now, because one, the vaccines are available. They've been proven to be safe. And COVID-19 during pregnancy is not safe. And the study I'm talking about was actually done from March 1st, 2020 until February 28th, 2021. So before the Delta variant. And so things are likely to be worse now. I think if you watch the news and you see all these stories about ICUs in the southern states filling up with pregnant moms, I mean, it's just impressive how unprepared we are for this sort of calamity. And so we just want to prevent it.
So if a mom is listening right now, and this is a program that's convinced her to go, and the pregnant mom is listening right now, and this is a program, our interview, that it has sending off that bell, that warning bell, and now she wants to get it. Where should she go? Where should the mom or her family members look for her to where she can receive the vaccination?
Well, for those who want to go on the Erie County website, they list all the sites. If you are more of a phone person, you call 1-833 New York State for VAX. I think that's easy to remember, VAX. So NYS, number 4, VAX, VAX, 833 NYS for VAX. We'll get you all the sites. And we're right now starting to vaccinate in doctors' offices. So actually at Kaleida, we opened up an office. We have our office at Kensington, and we put vaccinations in there just this week. So people who go to Kensington can get vaccinated. Niagara Street can get vaccinated. I mean, we are looking to make this available by every means possible. It is possible for doctors in the community to set up and get vaccine in their own offices. Gail Burstein, Commissioner of Health for Erie County, actually has a program that she's developed. So the doctor office can actually go get vaccine and dispense it in their own office. So we are trying to let people know we have plenty of vaccine. We're trying to make as many spots as possible. I hope we open up more than we have, of course, just to make it ever so easy. But you can also go to any of your favorite pharmacies in town, drugstores. Everybody has this. You can walk right into your local neighborhood Walgreens or CVS. I don't want to advertise for anybody in particular.
No. We're just giving examples. We're just giving examples. We're not advertising. We're sharing examples of the places you can
Right.
go.
I think you would be hard pressed if you were actually just wanting this vaccination now. Walking in any of the places that I've named will get you a vaccination.
Right. And knowing that the show ends at 8 a.m, every place we mentioned, all of the all the drugstores are open. So we know the pharmacist is there. So we just want to make sure that if this is what you want to do, you can do that right now. Just stop what you're doing and just go get the COVID vaccine for yourself, your baby, and for the little ones who might, or the family members at home, correct?
Well, I mean, that's such an important point. I'm so glad you raised it, because children are going back to school, and there was a study last week. I feel like I've had a steady diet of COVID-19 news. And I actually, have gone to the medical literature also, in addition to the newspapers and every other source of information. We had a big study come out in JAMA, which is one of our important journals, and it showed that children are clearly transmitting COVID-19 to adults. And, one article was about how birthday parties, and milestone birthday parties in particular, are sources of transmission. And children are going to go off to school, and clearly that's going to, increase the risk, because there are going to be people that are sick. And, you don't get sick first, you get infected first. You have symptoms later, but you can infect people before you become symptomatic. This is the scary part, right? Children are going to school. Children feel well the day they go to school. We've all, as a parent, gotten that call, your child is sick, come and get your child. And that transmissibility is really high the day or two before the child has symptoms. So the child brings home, COVID-19 to pregnant mom. This is like one of my worst nightmares, right? And so we're trying to make sure that everybody in the household and everybody at school is, one, vaccinated who can get vaccinated, and masked, so that we can create a wall against the virus, if you will, and so that home is safe, right? So if the highest vaccination rate right now is in the oldest part of the population, we need to get that into the parents' generation. So that all these children must have some parents. Parents need to be vaccinated, not just pregnant women, right? Dad needs to be vaccinated. Anybody living in the house needs to be vaccinated. Children over the age of 12 need to be vaccinated. I mean, let's not just stop with the pregnant woman. Let's just start there.
Exactly. And I believe if you go to the drugstore, if you're under 12, or I should say if you're 12 or over, I'm assuming you can get it at the drugstore. Is that what you're saying?
Yeah. And if you are the kind that wants to go to Erie County, you can get vaccinated there. I mean, again, pediatricians are having these in their offices as well. So, if you want to have your doctor do this, you can do that. Truly, there are many, many spots, almost too many to name. And I know that can be confusing, which is why I also said, these places that we all go, like a pharmacy or a drugstore, like, let's just go there.
Mm-hmm. Yeah, no,
it's free.
That makes total sense. It's free. It's free, and you can possibly get some. If you need to pick up a prescription, you can do that. Or if you're going to one of the grocery stores, you can combine it with doing grocery shopping, so you don't have to go to the doctor's office. Or, what Dr. Berger is saying, there are just many choices and places where you can go to receive the vaccine, and take anyone else in the family who isn't vaccinated, who is able and who's over 12, and just do it, as they say. So is it true that when the pregnant mom is vaccinated, is it true when the baby is born that the baby is vaccinated as well? Is that how it works?
Yeah, that's what we're saying. I love it. Vaccinated by mom. That's what mom always does. A mom who's immunized against flu or DTaP or any of the other sorts of things that we want mom to be vaccinated for during pregnancy or before pregnancy. Now, we just are adding one more to the list, and it's because that's what's in front of us right now. It says we have a vaccine for a really serious illness. And so it's the same for flu. Flu actually also isn't kind to pregnant women. And swine flu in particular, for those who remember, that was terrible for pregnant women. Pregnant women really had an excess mortality, and we were trying to get them all vaccinated. But across the history of humankind, there have been pandemics, and we can learn from that. And what we've learned is almost every infection is worse in a pregnant mom. Now we've got this very serious Delta variant on our doorstep, right? We have an increase almost every day right now. And we need to create a vaccination wall, if you want to say. Let's keep our community safe. And the way we do that is by getting the most high-risk people vaccinated first. So that's what we did in the beginning. And right now, the most high-risk people are the people likely to get the infection, those that remain unvaccinated, but particularly pregnant women, lactating women, and particularly people who might be pregnant, right? So some people are trying to be pregnant, and they don't exactly know when they're going to be pregnant. Take the worry out of that one. Get vaccinated now.
Exactly. And I also have to say that, this is summertime, and you have family reunions, and and they haven't been canceled, and you have family members traveling from Florida or from Alabama or Boston. But my point is that even if you think, oh, I'm just going to go and say hi for a second, I'm just going to go to the meet and greet program, or I'm just going to go to the faith-based program. To get COVID, it only takes probably a second because it's airborne, correct?
Yeah, that's really, I think, has been the message that we really want people to understand, exactly what you just said. They don't have to be symptomatic. They don't have to look ill. And it's spread by air, so you can't see it coming your way. And you don't know who it is. And so wearing a mask is certainly a great idea, even though who wants to go to a party in a mask? It's awful. But, if you're not vaccinated, you absolutely must.
But they do now make masks with bling and all kind of you can make your own mask to match your outfit. And as a matter of fact, if it's a family reunion, maybe the Friday night event is the most creative mask.
Yeah, I like that idea. I mean, we are having to making adjustments, right? And so
yes.
We can make the mask a fashion statement.
Yes.
I see these neon ones for those who like that sort of thing. I mean, sometimes I'm highly entertained by the mask the patients wear, and that's really fun. So entertain your doctor.
Right.
It's true. We should put a little fun in this, but I'm, of course, also wanting to make that party safer by making sure everybody at the party is vaccinated. Why not?
You're right. And I know we're running out of time, but just some tips. What should the pregnant mom do if somebody in her household does have COVID and she's pregnant and they don't have they're limited on space. They only have one bathroom and one, it's just a modest size. It's an apartment. What are some of the safety precautions the mother can take if there's somebody already in the house with COVID who's tested positive for it?
That's tough. Really, we want them away. Actually, we want them on a separate floor if possible. And I know that isn't always, and that is, part of the problem because it lingers in the air. And obviously, it's most contagious after the person was just in that room, or if you're sitting next to that person. So the closer you are, the worse it is. But people move it around in a house and they share common parts of the house, and so I think that's really rough. That's tough, and I feel for people in that circumstances. And that's really why when we get vaccinated, get everybody in the house vaccinated, because you don't want to have to deal with that situation. That is the worst case scenario, right? You're just afraid to go home.
Right. And everyone wear a mask and make sure it's clean, or if it's disposable, put a fresh one on at least every day, wear a fresh one, and try and stay safe. Dr. Berger, we have about a minute left. Is there something in the last minute you'd like to share that we haven't covered?
Well, I just really want to encourage everyone to understand that this vaccine is a medical breakthrough. And really, I know there's some nervousness and I want to say the one thing that I often hear is it's going to get stuck in my eggs, or it's going to get stuck in my body, and I'm going to have it come into my DNA. And I just want to reassure people that that does not happen. This is going to last in your body, about 48 hours. It's going to be gone. You're going to now educate your immune system, and your immune system's going to be smart. And that's what we want. We want us to be smart.
We want a smart immune system. Well, Dr. Berger, I just want to thank you so much for being our guest this morning on the Great Lakes Health and Wellness Program.
Thank you for helping us.
Oh, you're welcome. And God be willing, in 2 weeks, you will hear my voice again, and that's Francesca Messiah. Also, if you're looking for a career in healthcare or in hospitals or healthcare, please visit our website at kaleidahealth.org/careers. Be safe, be smart, and social distancing works. Bye-bye.